to record yet, but he is, that's okay. So just to review again, we've got the hamstrings, the glutes, and the lateral rotators that we're going to cover when your client is prone. Okay, so we'll start with the hamstrings, and then I'll probably just do it all in one part, because the glutes and the lateral rotators and the hamstrings, they all are in such similar areas of attachment that it doesn't make sense to break it up too much. Okay, so coming here, we'll undrape our client. Same thing, we want to make sure that we're undraped in a way that if you want to tuck underneath their stomach here, and you can tuck under their quad. Can I have some? Thank you. Okay. So just like we did with the quads, grab some cream or oil and just spread through that whole area. Okay, and again, we want to make sure we get up into where we find that greater trochanter, okay, which is right on the outside of the hip. Okay, greater trochanter is important because we have a lot of stuff attaching here. Okay, we have 2 out of these 3 groups of muscles attaching around the greater trochanter, both the glutes and those lateral rotators. So even spending a lot of time working through the greater trochanter is really important. Okay, so again, lots of effleurage. We can get some kneading in through here. Okay, we're getting a little bit of the IT band as well here, so keep in mind that people that have a lot of IT band issues work it from both sides. So here I'm doing that same sort of myofascial stretch when the person is prone, and I'm getting more the back side or the posterior side of the IT band. Okay, so another important landmark here on the posterior thigh is that ischial tuberosity or ischium, okay, which I'm right here on. It's your sit bones. So I start out doing a lot of just localized thumb work, and I'm obviously holding this drape so you can see where I'm at. Okay, a lot of times you might even be at the edge of your drape while you're working there. So using both your fingertips, and your thumb, I'm just doing, like I said, a lot of localized cross fibers, little circles, back and forth, up and down, trying to encompass as much of this ischium as I can. Okay, when we look at those lateral rotators, they're attaching at the pubic ramus, the ischial ramus, okay, around that obturator foramen, okay, which is the big hole through which our blood vessels and nerves pass. So as much as you can get in this area, it's a little complicated, but the more thorough you are, the better. Okay, so those lateral rotators come from that area around that ischium straight out to this greater trochanter. Okay, so this is where those lateral rotators are. So a lot of time spent here, the lower part of the butt, okay, upper part of where the hamstrings are. I like to do a lot of this heel of my hand. Lots of pressure here. Okay. For hamstrings, I do enjoy a lot of knuckle work through here. As always, you can get some forearm in here too. Okay, which is nice because you can get all the way up to that ischium and then use the tip of your elbow to access that a little bit as well too. How you doing, Holly? Great. Okay, I know too there's the figure 8 where you're kind of hand on hand and you're drawing a figure 8 in all areas around the back here. And again, we can see some of the pink coming up from her skin. She's got a lot of heat coming forward. Okay, moving on from there to glutes, I'm just going to pull this drape down so I can get to her sacrum a little bit better. I want you guys to palpate the sacral edge, and that piriformis attaches on the anterior surface of the sacrum. So you do have to get underneath the edge that is available to you right now, I guess. So again, I just kind of use my fingers to get in there, draw little circles around the edge. Okay, but that piriformis, same thing, comes from the anterior side of the sacrum down to this greater trochanter, so it looks kind of like this across, attaching the sacrum to the femur. And again, that sciatic nerve in some people goes underneath, okay, and others it goes right through, which is why we get sciatica or sciatic pain caused by tension in that piriformis a lot of times. Okay, so any area that you want to work around the whole butt area is really good because it's working that piriformis. People with piriformis issues, they're going to be howling during this. So work again within your client's tolerance level. So I'm just trying to cover a nice broad area and work a little bit, get everything warmed up. Okay, in the next part, we're doing like a pin and stretch. So we're going to grab their ankle. And sometimes before I do this, I like to do a little bit of a jostle to loosen up where I was. So I kind of make interlace my fingers and lift up at their ankle. And then just go forward and away. Okay, make sure that their hip is relaxed because it doesn't work. Most of the time, the first time you do this with your clients, they tighten up. So Holly, tighten your butt. Okay, and you can't do anything with that. So I put them down, I just say, okay, relax, relax, keep your hip relaxed. You can come back and do it. Okay, once I do that, I kind of do the same thing I was doing without their foot up in the air or their knee flexed. Okay, so you're putting pressure in either with the heel of your hand, with your thumb, or with your fingers. And you're going to create all types of movement through that lower leg. So you can go forward and back, up and down, circle one way, circle the other way, diagonal. Okay, the more ways that you are able to move their leg, the more that muscle shape is changing, and the more you're able to look for knots or just stretch the areas that are tight. Okay, you can also, if the person has a lot of issues or if they have a higher pain tolerance, you can sink in that area with your elbow too. Okay, same thing. So I'm kind of just staying in one place now. And notice again, I'm kind of just leaning in. I'm taking a breather now. This is not it's not difficult for me to do this at all. Doing okay, Hal? Okay, so then I might move a little bit lower. Okay, again, pay attention to their nonverbal. Since they're face down, you don't see their facial expression, but you can look at their butt. If they clench their butt, okay? If they stop breathing, pay attention to the back of their rib cage. Okay, you can come back through and do a little bit more jostling here. But that's mostly it. You can do the same type of pin and stretch, placing the heel of your hand in between their ischium and their greater trochanter, so right in the middle of where those lateral rotators are. Okay, and do the same type of pin and stretch. Might be more comfortable for you to use. Here, let me this up here. So here's her ischium, here's that greater trochanter. You put your thumb right in the middle there. You can do the same thing, and you can, when you do this, especially with a back and forth motion, you can feel those muscles contracting because essentially you're rotating their hip, right? So all these lateral rotators help you laterally rotate. So again, by creating that movement, you're helping get in between those fibers. Okay, I'll show you guys a quick psoas stretch before I let you guys work. Okay, so when you're here, after you've kind of warmed everything up, and of course we've done the psoas work supine and side lying. A good stretch is, I use my knee because it's easiest, less fumbling. If you want to use a bolster, that's fine too. But I lift up and put my knee underneath their knee. Okay, so their hip is in full extension. Okay, and then I just kind of hold down right around where that greater trochanter is. I'm not pushing down, I'm just bracing it. Okay, and then we're going to flex their knee to open up that hip. You doing okay, Holly? You feel a stretch in your hip? Okay. So again, talk to your client. How does it feel? Is it too much? I'm going to come over here, Conrad, and get my hand placement for me. So I'm here at the greater trochanter bracing, and we're opening up this whole area here underneath where the psoas is.
Could you actually put your other hand down underneath the knee and lift the leg up?
Yes. So you could kind of, sometimes with people that are really flexible, I'll kind of hook their foot behind my ear a little bit, and then I grab up with the one hand, and then I can stretch them a little bit more this way. Okay, but again, this is just when you got to get creative when it's not doing it the way you want it the first time. Okay, a good way to come out of this, I have their legs straight. I'll reach underneath at that psoas area here, right by the ASIS, and I'm going like this with my fingers, and a nice pulling stretch down the top of the thigh. How's that feel, Holly? Good. Okay. So then she comes out, same thing, a little bit of jostling, and then a nice hip pull, and that's it. Okay.